and welcome to the Social Newsroom. I'm here with someone who you might think is a double because we haven't spoken, but we happen to have the same color shirts. Dr. Mwendwa is our guest for this episode of the Social Newsroom, and he's here to talk about not only the state of health, and that is more from his own sitting point or vantage point, having experienced it as a student, preparing to be in the medical sector, and now practicing, as well as his other facets in life that he wears many hats. And you're about to see that. So I'd want to introduce you formally to Dr. Mwendwa, a rapper, a father, a husband, an activist. You'll hear about that, what activism looks or feels like in his own day-to-day life, as well as a pediatrician. You've seen him as Ask Dr. Rain online, whether it's on Twitter, whether it's on Instagram, as well as on TikTok, yeah? You're on TikTok. Recently. I think you're one of the few doctors I've seen on TikTok. And I really, really appreciate that he's given us time this evening. He's come on time and he's ready to shoot. The first thing that I want us to address, ladies and gentlemen, I don't know if you have seen it. First of all, I saw it on WhatsApp. And then I saw an article on the Daily Nation. And this WhatsApp article was saying it's something more alarmist. And it was about COVID. And it says, as received, Ministry of Health report, COVID and translated XBB variant. Everyone is advised to wear masks because a new variant of the COVID Omicron XBB coronavirus is different, deadly, and not easy to detect correctly. And if you read further, someone like me who's had a flu for the last 3 days, I had to ask a few people, amongst them Dr. Rain, asking, is this real or not? And we have some communication as well from the newsroom on what this is. But I'll want to refer to the article, if you can look at it, for our team to just scroll through that headline. Hospitals struggle to provide oxygen as COVID-19 cases rise. This was on this Monday, June 12, 2023 page for the Daily Nation, and the story by Angela Okech, a health and science reporter. And the first two lines, I'll read them because this is what gets your attention. Kenya could be experiencing a silent surge in the number of patients requiring oxygen as the country faces a new wave of COVID-19. In the recent past, a number of Kenyans have tested positive for the virus, with many experiencing severe symptoms that warrant oxygen therapy to enable them to breathe. So let me ask Dr. Rain, first of all, from what he's seen, since he's in the circles of, the medical sector, he's talking to the experts themselves in terms of respiratory diseases, those who are keen on that. Daktari, is there a new surge of COVID-19, or is this an alarmist, especially the WhatsApp message that I sent first?
Okay, so number one, COVID-19 never left.
Oh, it's still with us.
COVID is still here. It's still alive and well. It's only that it's not doing as much harm as it was. And the stance from the WHO and a lot of other countries is that it was no longer declared a global threat or a pandemic. If you remember, just a few months earlier this year, a lot of the measures have been stepped down in terms of masking in places and things like that. But here's the thing, COVID has been with us, it's changing, yeah?
Yes.
We started, you had Delta, you had all these other COVID viruses as they keep mutating into different variants. So this particular variant that they're talking about, XBB variant, was actually discovered December and early this year. Last year, December, early this year. And it keeps changing. It's been classified as a variant of interest. Why is it's because it is currently the most common strain. It's extremely virulent, meaning that it can spread very easily. Okay. Just like Omicron, at one particular point, Omicron was the most widely spread. But as this virus changed, as our immune systems got better, as people started mass vaccinations, what happened is that the disease was not giving you this deadly effect that it had early on. Before you had COVID, in 3-5 days, you're in ICU. Now it's very different. What we're seeing right now in Kenya or within our region is that we're seeing a surge in viruses. We're seeing a lot of influenza virus, what we call the RSV or the respiratory syncytial virus, and of course COVID-19. So we have a triple threat, as they call it. Sometimes you can have co-infections, meaning that you have influenza
Yeah.
and you also have COVID, or you have RSV and you have COVID. Now, I wouldn't tell people to panic and start going back to masking. I would always say hand hygiene is important. It prevents so many diseases. When COVID came, just because we had to keep our hands clean, we've seen so many diseases and hospitalizations reduce because of just practicing hygiene.
Okay.
If you're sick, if you have cold symptoms, it doesn't hurt wearing a mask because it means that you can't pass it on to the next person.
Right.
So you're going to reduce the infections. Those people that should be very worried are the elderly people,
Yeah.
65, 70 and above, and you have all these other issues, high blood pressure, you're obese, you have diabetes, you have heart disease, the likes.
Okay, so for someone like me with a flu that isn't as usual in the sense I'm feeling quite down, what should I be looking out for in case I really want to confirm if it's COVID or not?
So here's the thing, influenza, RSV, COVID, all the symptoms are more or less the same. They're all
Right.
respiratory symptoms, so it will be the usual. You can get fever, you can get cough, you can get sore throat. COVID had this distinct thing of losing smell,
smell
but
and
that
taste.
changed even with the variants of, with the Omicron virus. People are not really losing sense of smell.
Tell you what, let me, sorry for interrupting, but and I know we can get a bit not conventional on this show. And to prove that, let me tell you one of the symptoms that really got me off. I couldn't get up for like 3 days. So I was like, iko shida. But it was the least of my worries because I was feeling whack for like joint pains. I'm feeling like the fever, weak, fatigue. But yeah, I'm good now. So, you
Good.
know,
I'm glad you've got that back.
bendera inasimama, so I don't think
So
it's
that's
COVID.
the thing with viruses and
Yeah.
infection. We did have a study about COVID-19 and the long-term effects,
Yeah.
especially a lot of men. If you remember, there used to be a lot of myths about COVID, that if you get it, you get impotent, or if you get the vaccine,
Yeah.
then usually, even in terms of libido, some issues. We did see some post-COVID-19 libido issues. So it could have been COVID-19.
Yeah.
But the thing is, if you're eating right, drinking enough water, maintaining hygiene, you don't have any underlying issues,
Right.
your immunity will sort it out. And if you've been vaccinated, that's another thing.
Yeah.
Yeah.
Which I have, and just for the record, for the bloggers if they're watching, it's all good. It's all good now. Bendera inasimama na inapepea na tunashukuru Mungu. But let me give you on record. So I consulted with one of the health journalists, and that is Helen Aura, who reports for NTV. And she did talk to the health CS, Susan Nahumicha, asking whether or not what we're experiencing is a new outbreak or a new variant of COVID-19. And she said it is not, based on what they have researched and established, that it is a case of flu, and they are attaching that to the change of weather. But they will be having some surveillance at entry points, where
Yeah.
if someone shows any symptoms, flu-like symptoms, they would be tested, and then they would take the relevant measures moving forward. So other experts are calling this influenza, and you have actually mentioned one of the three main hits that we're getting, respiratory hits, influenza, RSS, and COVID-19. So just to put it on record, the health ministry says this is not COVID-19, but they're continuing with the surveillance. KEMRI as well will be giving a position tomorrow on this, but the Ministry of Health will be giving a statement this evening, but that is confirmed, and thanks to the correspondence of Helen Aura from NTV, credit where it's due. But Dr. Rain has also put that on record. So let me attach that to how I have known you. I've known you before and through people that we have, mutual friends that we have, but how I've followed you more is the fact that I'd call you a myth buster. And it's on the medical side of things, where you look at what are commonly held beliefs or practices, and you counter them with science and fact.
Yeah.
And that's how I've known you. So how did it start exactly for you that you became, that guy who's Ask Dr. Rain? They know you for that.
So I think I became more fascinated. Of course, I'm a doctor.
Yeah.
So when you're a medical officer, you know, you learn a lot of things. When you're in med school, you also learn all these, you read all these extensive textbooks. But when I actually started my master's in medicine, you understand that there's different levels of evidence. Not all studies will provide the same evidence, how you conclude things, and then just basically learning to appreciate science a little bit more. I had to go through a lot of personal unlearning, a phase where I had to strip myself of the things that I thought were right. Most of those were religiously attached, and learning how not to use your culture, your faith, when it comes, especially when the scientific evidence is strong.
Right.
And then 2020 COVID happened, and there was a lot of myths, a lot of myths.
And those
Get
forwards on
COVID,
phone, WhatsApp.
yes,
Yeah.
exactly, those WhatsApp messages. So there's a lot of misinformation, and the only people that were countering the misinformation was, you know, like a WHO, the
Yes.
Ministry of Health, but it wasn't really, it wasn't hitting home.
Right.
The way that message was coming about, guys want, when you talk to people, or when you're a doctor and you want to explain a situation, you can't talk to them in medical jargon.
Yes.
You need to get down to their level so that they can understand and say, look, virus is like this and like this, you know, and these things change. So that's when I realized there's a pandemic, there's a global threat, which is misinformation.
Right.
Because a lot of people didn't get vaccinated. I know it's something that I'm still fighting today, not only with COVID vaccination, with HPV vaccination for girls that can prevent cervical cancer, that is killing so many women in this country. So very, very many things that we believed was true, or very many things that even our parents did to us, and we believe that this is the remedy, you know, steaming and things. There are some things that have in Africa, we have a lot of medicine that is good and
Yes.
probably has potential. It's just we haven't researched. So we also can't say that, well,
can't
this
dismiss
herbal,
it.
yeah, we can't dismiss it
Right.
because we don't have the research.
Especially
behind
your
it.
dawa ya Masai. I've been meaning to ask.
Yeah.
I'm sure umewaona.
Yeah, the Dawas, the Maasai. You know, there's a lot of, you know, traditional, and I believe the root,
Yes.
if we go back to pharmacology and all the drugs, most of the drugs that we take as tablets today are derived, you know, from
Correct.
herbs. It's just that we've managed to, you know, synthesize, manufacture, get better
Correct.
at it to a point where you don't have to boil leaves. Yeah,
Yeah.
you just take the tablet and it does the same thing.
Speaking of which, umaitumia dawa ya Masai?
No, the Maasai, no, hell no, because
Hell no.
we get a lot of cases of people getting there with liver failure, kidney failure. You know, you don't know what these things
And you
are.
and you can, you know, connect that to the dawa ambayo alitumia.
Yeah. So most of the times, it's one of the things of medicine, and that's why I keep telling guys, please don't. I know I'm a doctor, but you can't just go on Twitter and say, "Daktari, I have this and this, sort me out." Or I've seen this trend on Twitter where guys go, "Madaktari hapa kwa KOT."
Yes.
This person, and maybe it's just one paragraph. You need to be able to take history
Yes.
properly. You need to sit
Right.
down and ask certain questions. And then there's also the element of examination.
Right.
So if I ask you, if you come here and you have liver failure or
Yes.
kidney failure, first of all, I'm asking, how did your kidneys start failing? What drugs have you taken? You know, do you have an infection? If I've ruled all of those things and there's some things missing, one of the things I'll ask is like, have you used any herbal teas, herbal medicines?
Right.
Because believe me, as a pediatrician, I've seen it with kids coming in and they die. Because even there are a lot of these kupaka majivu
Yeah.
in the gums for kids. So there's this thing of like they burn some trees
Yeah.
or herbs, and then they rub the gums of especially kids who are teething.
Yeah.
And then that causes just all sorts of toxic reactions to the liver, to the kidney. These people come in kidney failure, they need to be dialyzed. So I can't take it because I've seen it.
And this you saw in Lamu, your time
This
in Lamu.
is just during my, you know, I've seen it in Kenyatta National Hospital where I did
Right.
my internship.
Right.
I've seen it in Lamu. I've seen it everywhere. I've seen it even in private hospitals where I work, believe it or not. Because guys will still take it. You know, if
Right.
let's say you have a problem, you don't want to see daktari pesa mingi.
Yes.
This guy's got mukumbero and he's telling you he can get it up.
Right.
What you don't know is that these people crush Viagra and rub it on this stuff as well. These are trends that are also happening. And people start taking
Hawa
stuff,
madaktari wa, ukiwa na shida ya kimapenzi au kila
all
unatumia.
that stuff.
Allah.
Going to the doctor, kukatwa kilimi,
Yeah.
crazy stuff.
And so for you, it really, it was out of frustration that you came out and started addressing these things, especially, and there was an explosion of misinformation over COVID-19. And so you took it upon yourself. Is that when you kind of rebranded to, Ask Dr. Rain?
Yeah. So what happened was, yeah, there's a time I think something just I think it's just viral sensation. Yeah. So one of my clips went viral,
Yeah.
and it was the time where COVID-19 was really, really bad.
Yeah.
I have been telling people about, you can imagine it's the journey. Yeah?
Yes.
So I'm telling guys, please wash your hands, blah, blah, blah. Everyone is saying this is a hoax.
Yeah.
This was something from China.
Right.
Don't pump us with those things. And this time vaccines were not even there. The time where doctors really started dying. Doctors just started dropping like flies. Hospital ICUs were full. Nurses were dying. We didn't have access to vaccines. So there was a clip that just went viral because I was like, guys, basically, if you're a doctor, I was like, I'm not even talking to, if you're in a healthcare worker, we don't have PPE. KEMSA scandals are going on. People are blowing billions,
Yeah.
but we're dying. Please get yourself life insurance policies. It was a real conversation where I also had to talk to myself and realize, oh my God, I don't even have a will. If I die right now, I don't know my wife, this, all those aspects were there. So it started there, it became viral. And then I realized, okay, fine. I have a platform, I have a voice. Let me use it. Because my
Right.
Instagram was never for medical advice. My
Yeah.
Instagram was for me being an artist, dropping new music, the usual things that wasanii hufanya. Yeah.
Luku, nini,
Yeah,
just a
exactly.
good life.
Exactly.
Yeah. So COVID came, it's still with us, but the harsher side of it was dealt with based on vaccinations and with more knowledge about it. But is there still need for Ask Dr. Rain? What have you seen and what are you going to get into?
So yeah, definitely. You're going to see definitely more of Ask Dr. Rain.
Right.
I'm planning to expand the brand. I'm planning to do, because a lot of my health talks, usually I just do it. And I always tell people, I educate for free.
Yeah.
I consult for a fee. So I'm trying to get the message out to people, get into production, but to get the message out, to do it well, incorporate sponsors, have more of that on board, making it into something that I want to do. It's something I'm very, very passionate about. It's a niche that I have right now. So definitely, and that's going to be on all the social media platforms. But eventually, even I was mentioning to you, like, this is a very, very good platform. Like,
Yeah.
this is something that I want to venture.
Right.
The crazy thing is that the Ask Dr. Rain concept is actually a TV concept. Because I started off as a health TV show.
Yes.
I used to do a show on Ebru TV back in the days.
Yes. I
And then when
remember
that didn't work out, we looked down, we sat with the producers, sat
Yes.
with my friend Davi, and we said, look, let's turn this into a health show.
Right.
But that never took off because mainstream media has had it's been very hard on mainstream media
Right.
in terms of budgets and things
It's
like
true.
that.
It's true.
And where we're headed is what we're doing right now.
The digital
everything
space.
is the digital space.
Right.
It's the podcast space. It's, that's the avenue that I want to get into because I found it's more impactful than actual mainstream media.
And trust me, that's a heavy statement. Trust me, there's enough space at Summerbox for, minds like yours to translate the knowledge that you have to educate masses and even to partner with those people that you feel can come in to support the episodes that you have. So you never know, you might be signing up for Summerbox and because the team here is ready to work with you on that. Tell me about the common, because you've said Ask Dr. Rain is still relevant even after COVID. Tell me about some of the top 5 myths that you came across and you just flabbergasted. You're like, damn, Kenyans, wake up. This is a lie.
So I've never been a what you call it? I've never been a Twitter guy.
Yeah.
I find it very Twitter, man. Kenyans are special on Twitter, man. You need another sleeve,
Yes.
you know, like where to wear your heart. But what I realized, I'll go based on the things that really, really trended. So what I realized is one, speaking of respiratory things, pneumonia.
Yes.
So there's one I was telling guys, you know, as a kid, you're always told, don't go play in the rain, vaa sweater, kuna baridi, utashikwa na pneumonia.
Yeah.
And it's crazy. People call it pneumonia. That just trended.
Yes.
And everybody was like, how can a doctor tell people not to dress
Their kids
up
warm. Yeah.
and dress their kids warm? And these are the doctors you want us to go and see. Like people actually, and I was trying to tell them, look, pneumonia is either caused by influenza virus,
Right.
RSV virus, COVID-19 virus, streptococcal pneumonia bacteria. That's what causes the pneumonia.
Right.
It's not the viruses, the bacteria might thrive in cold conditions, but even if it's minus, and the logic I like to use, because I did my medicine in Russia.
Yes.
Now in Russia, those guys are crazy. Like it could be minus 15 where I used to stay, and minus 15 is normal in winter. Minus 15 degrees outside. You're with your grandmother, your mother,
Right.
and you have maybe a 1-year-old or a 9-month-old, and they'll tell you we're going out for a walk. they do a lot of walks. They're very healthy. It's
Yes.
one of their social things.
Yes.
But it's minus 15 outside. But they're good because they know that the kind of prams they have and whatever
Yeah.
and things like that. So I'm like, why are you worried when kids are taking minus 15 walks and you're worried about a sweater?
Yeah.
That sweater won't change your degrees.
Might give them the sniffles though.
Now, you could be dealing with something else.
Okay.
So if you have an allergy to cold, if it gets
Gotcha.
cold and you start coughing nonstop and you
Yes.
start getting sniffles and
Yeah.
then you need to dress warmly.
Okay.
But is it the cold that is giving you the pneumonia, or
Yeah.
is it the allergy to the cold?
So there's that pneumonia one that you noted. Which other one did you come
So
across?
there was that. There was the story about kilimi, which was something that we see a lot. So your kilimi basically is your uvula,
Yeah.
that thing that dangles. A lot of Africans, and I say Africans because I researched it, and in different countries they have different things.
Yeah.
Here it's if you have a cough, mainly if you have a cough or you're always getting what we call recurrent
Tonsils.
tonsillitis,
Yeah.
they believe that it is the kilimi. But the uvula and the tonsils are totally different things. The uvula is just part of what you call your palate or the palatine.
Yes.
And then your tonsils are just glands. They're actually called the adeno-tonsils and the palatine tonsils.
Yeah.
Some are here, some are uku in the nose, uku
Yeah.
nyuma and stuff. So people believe if you cut, goes in like Sudan, Ethiopia, when a child has persistent diarrhea, vomiting, always getting sick, they also cut it. Sudan, they believe if you have fevers, they also cut the uvula. So that also was a surprise. In fact, I think the most impactful thing was when I got on TikTok and I put that out there, and I was taking my car for alignment. And one of the mechanics says, "Hey doc, I saw your thing on TikTok, and I'm grateful for that video you put on Kilimi, because my wife and my mother-in-law have been stressing me to cut my son's Kilimi, and I didn't like it, because you can't go to a doctor. We're not taught that in medical school.
Yeah, yeah.
You go to some traditional person, they put a spoon back in your throat. Like even when you saw the thread, like it also gave me what people are going through.
Right.
Like people talked about how to this day it's traumatized them.
Yeah.
And then you have other people
So
saying,
what is it that they do? They put a spoon?
they usually use a spoon,
Yeah.
like a spoon, and then just like very sharp scissors. Not like surgical scissors, but just very sharp scissors.
No anesthesia, no nothing.
That has been really,
No
They
anesthesia.
put that down. Somebody holds, usually an elderly woman and a grandmother. They cut it. And then what I've seen is commonly they give you stony after that. I think it was the tangawizi would give you that, but it's still
Numbing you or something. Yeah.
let's say walikuwa bofu
My goodness.
like it's crazy. So some people it resolves. You see things like cough and colds.
Yeah.
As a child's immunity gets better, they tend to stop getting sick all the time.
Let me ask, so because something like that one would think it's not practiced with the learned, exposed people. Ni ya watu wa mashinani. But watu wa mashinani watakupata kweli kwa mtandao. What's the end
That's
game?
the funny thing. I thought that too.
Yeah.
I felt like, okay, maybe on Instagram, no, because Instagram really consumes a lot of bundles. But
Yes.
on Twitter and TikTok, surprisingly, I don't know if
Right.
TikTok has a thing, but there's a lot of people, even if you look at some of the TikTok content creators,
Yes.
a lot of them are from Mashinani. Not all of them are from Nairobi.
Got you.
You find a lot of trending stuff that's on TikTok. So surprisingly, there is actually a lot of people on social media, Twitter, TikTok, Facebook. So it's impactful.
So besides the uvula one, the one for
So there's that one for pneumonia. I kept telling, what else? The one for kids.
there's
telling-
the one for homa and antibiotics.
Yeah, antibiotics. Yeah, please, don't give your kids antibiotics for every homa they get, because an antibiotic is supposed to kill a bacteria. Most of your kids get viral infections. A homa actually is fever, but anyway, homa in Kenya is flu symptoms.
Yes.
But flu symptoms, viruses, you give an antibiotic, even if you don't give that antibiotic, it will eventually clear. It's what we call a self-limiting disease. And before you take an antibiotic, go see a doctor.
Yeah.
Don't get it over the counter. It's what you're doing is illegal.
Yeah.
What you're doing is you're creating more room for antimicrobial resistance, which, by the way, is going to be now our new pandemic, because nobody is spending money on research.
Right.
Of late, the news is a lot of our problems in Africa can be solved with science and researching about problems, not only just medical, researching why is it that development in Africa doesn't kick off, what is our problem with corruption. All that requires research and some form of systematic ways of gathering evidence of where we're going wrong and how we can be better.
Right.
But nobody spends money on research.
Proper research.
Everybody's trying to solve a problem. Everybody's trying to sort out famine, receive aid, food aid, that type of situation.
And I mean, there's that one, the people, and I think this is backed by some, areas that don't practice, cutting of the foreskin. You are more predisposed to sexually transmitted diseases.
Yeah, very true, by the
Yeah.
way.
So this is
That's actually a topic that I haven't actually tackled,
right.
and is actually a good one to talk
Yeah.
about.
So it's not just cheap talk that, hey, what's it?
No.
Fanyeni
If
hiyo
you're
mambo.
circumcised, it's proven that once you're circumcised, the chances, it's to do with the hygiene theory and
Yeah.
retaining of semen and things like that. Circumcision does help. However, it's a slippery slope, because we're not saying get circumcised,
So
then
you're free.
don't use a condom,
Right.
because you're not going to get it. No, we're just saying that if you're circumcised, you're at a lower risk of getting a sexual transmitted disease
Right.
than a circumcised person.
And there's something else that is, conversations held without proper information. And, time immemorial, the FGM, let me call it that, that it was done to control the sex drive of girls in some community. Is there any connection as to whether or not it?
The funny thing is, like I said, I trained in Russia.
Yeah.
So when you train outside, you have to come to the Kenyatta or another you need to acclimatize yourself to our health-related issues.
Yes.
And I remember that's the first time I heard the word FGM.
Right.
I was a whole doctor, I was an intern, but it's the first time a nurse came and is like, Doc, I can't deal with this one. That's FGM. Go and tell the obstetrician gynecologist resident that we need to go in for a cesarean section.
Yeah.
So, again, an abbreviation I've never heard, FGM.
Right.
But it's really, 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 I'm sorry to say, it's very barbaric.
Yes.
To some people, it's their culture, so they might take offense that I'm calling it barbaric, but
Yeah.
it is exactly that, because you are literally, you can imagine, the birth canal is basically closed.
Yes.
Basically closed. There's only like 2 centimeters, or maybe even a finger can go inside. So sometimes you even wonder, how did this person even become pregnant when there is literally almost no opening? You know, because what they do is that they fuse, or they cut the labia, and it becomes fused together. And you can imagine somebody trying to give birth. So a lot of
Right.
mothers die because, one, they have a horrible sexual experience. I mean, one should, you know, you should be able to experience pleasure, you know, with your, if it's your wife,
Yeah,
your
yeah,
whatever. That's, even if you're into religion, that's your God-given thing, you know.
yeah.
So one, you've taken that away from the person. And then two is that you're putting them at risk because they can get what we call obstructed labor. So the baby dies, and if the baby dies inside there and it can't come out, then the mother is also going to die. Because now the body looks at the baby as a foreign object, and then it causes infection called sepsis, and then the person dies. So it's
And I know that's
crazy.
not like your core area of expertise, but the reason I ask is because you're looking to engage other experts in the medical field as you continue to grow as
Yeah.
Dr. Rain. And it's something that is needed because you are in that field, you have access to them, and there is need for this information.